Bleeding after sex may be a very serious issue and may also not be a very serious issue depending on what is causing it. In today's video, I'm going to be explaining some common reasons why you may be bleeding after sex. Hello everyone and welcome back to the YouTube channel. If you're here for the first time, hi, my name is Busari Molayo and I'm a registered nurse. On this channel, I film content related to nursing and healthcare, and in today's video, just like I said earlier, I'm going to be explaining common reasons you may be bleeding after sexual intercourse. Please, if you haven't subscribed, click on the subscribe button to join the YouTube family and also click on the bell icon so you get a notification whenever I drop another informative video like this. Now let's get into the topic. So bleeding after sex is actually called postcoital bleeding, like that is the medical term for it. And just like I said in the introductory part of this video, it may be something very serious, and it may also not be something very serious, like something serious in the sense that you may have to go to the hospital, get treated, get medications, sometimes do surgery depending on the cause. And it may not be serious in the sense that it may just be something that requires lifestyle medication. It depends on the cause. So the best thing if you have postcoital bleeding is to take a trip to the hospital and see a doctor for proper examination. But that doesn't mean I won't tell you common reasons, just like I promised. So the first thing is vaginal dryness. Now there are different things that could cause vaginal dryness, possibly because you're not properly aroused for the whole intercourse you get, or probably because you have issues with your estrogen levels. It could be any of those. But the issue with vaginal dryness is that there is tendency for friction during the intercourse. So with the whole trusting in and all of that, there could be friction that could cause bruising of the vaginal walls or inflammation through the whole friction and the force and everything, and you begin to bleed just the same way you would have a bruise if you fall down or you sleep or you bruise your hand over a wall. It's just the same mechanism that is causing the bleeding in that sense. So vaginal dryness could be due to lack of arousal, could be due to issues with estrogen or other hormonal imbalances. So the best way to ascertain that is to get a test done. Second thing that could actually cause postcoital bleeding are infections. Now there are different types of infections that could affect the vagina, ranging from bacterial infections to yeast infections to viral infections to sexually transmitted infections. Now one general thing about infections is that they cause things that should not happen. So the wall of the vaginal is not going to be the way it should be normally. The environment is not going to have the right pH. There are so many things that should be there that shouldn't be there that are going to be there. Do you get? And the way the body responds is called the inflammatory response. So once there is inflammation there during sexual intercourse, you may bleed. Cervical cancers, yeah. The cervical cancer comes in different stages, but one of the signs or the cardinal signs of cervical cancer is postcoital bleeding. Another thing that is actually not so serious, that may not really require medical attention, is rough sexual positions or styles. When the man or the woman is too aggressive during sexual intercourse, there could be injury to the vaginal wall or structures in that area, causing the woman to bleed after sex. Finally, another thing that could cause a woman to bleed after sexual intercourse is chemicals and irritants. Introducing chemicals and irritants into the vagina will alter the pH. It could make it dry, it could make it inflamed, thereby causing the woman to bleed after sex. So you realize that some of these things require medical attention, while some just requires you to stop doing certain things. But so as not to trivialize a serious issue or to make a mountain out of a molehill, it is best to see a medical practitioner, do your test, do a proper history taking, do your proper physical examinations to ascertain the cause of postcoital bleeding. Please note that postcoital bleeding is going to be diagnosed if it is not happening during your period or after childbirth. Please note those two things, because it is expected that you will bleed through the vagina while you are menstruating, and it's also expected that you have your local drainage after childbirth. So those two are not postcoital bleeding. Exactly. Hope you get my point. So if you understood everything I said, let me know in the comment section. If you have questions, drop them in the comment section. If you enjoyed the video, give it a thumbs up, and if you want to see more videos like this, click on the subscribe button and join the YouTube family. I'll see you in my next video. Bye.